First diagnosed case of Ebola in the United States. CDC made the announcement in a press conference this morning. I guess you might have seen it. I don't know. The patient tested positive in Dallas, Texas. Male, recently traveled to Liberia. He left the country on September 19th, arrived in the U.S. the following day, which would be September 20th. What's the date today? September 30th. Ooh. That's according to CDC. He exhibited no symptoms until about 5 days later. And according to the press conference by the CDC this morning, if you don't have symptoms, you're not contagious. Oh, well, okay. I can imagine that the people who flew here from Liberia through U.S. skies on their flight, and nobody has announced, to my knowledge, what flight it was, what airline it was, what have you. But I would imagine those people a little bit nervous. Well, will be once they find out. Anyway, he went to the hospital on the 26th, was admitted on the 28th, tested positive on the 30th. That would be today. And the CDC spokesman, Dr. Thomas Frieden, said that this man is, Frieden's words, critically ill. Now, officials have declined to give out too much information. They declined to say if he was a volunteer working over there. They declined to name the airline. They also declined to say even if he traveled on a commercial flight. Oh, don't we love secrecy? Well, they don't want to cause panic. Chris Matthews almost went out of his skin tonight. That was really something to listen to. I can imagine what it looked like. Chris Matthews chewing up the cameras in the set, as he's going crazy about Ebola in America. Dr. Frieden said Ebola can only be shared or spread by sharing body fluids with an infected person. He said the virus can be killed, quote, by washing your hands and wearing gloves. Well, that's good to know. That's good to know. And the patient is in isolation in this hospital in Texas. He'll be treated in Texas. Frieden said, quote, virtually every hospital in this country that can do isolation treatment for Ebola. Okay, well, that's all good to know. And the CDC sent a team that's already in Texas to identify all the individuals who have come into contact with this man and to monitor all these people for the next 21 days. Apparently, that's the incubation period. About 21 days. Kind of scary, huh? The doctor declined to say if the individual is an American citizen, but he did disclose that the Ebola victim is in this, or the Ebola patient, I should call him, is in this country to, quote, visit family. And the Dallas County, Texas Health and Human Services Director said that the city is more than able to contain and treat the isolated patient. The director said, quote, this is not Africa. We have great infrastructure to deal with an outbreak. The death toll, I think, is approaching 3,500 in West Africa so far with, 8 or 9,000? Is it up to that yet? Infected. Dr. Frieden, the CDC dude, said, Ebola is a scary disease. We're really hoping for the recovery of this individual. We're stopping it in its tracks in the United States. Well, that's good to know. I would hate to think that there's a chance that Ebola will break out into the general population or part of the general population. I know that's what the 1/10 of 1% are hoping for. The trillionaires, almost trillionaires. This would cure a lot of their problems. Just wipe out with Ebola, and of course they'd be okay. They'd stay away from anything contagious or infectious, I should say.